and welcome to Acme Canine's Coffee Chat, the place where you gain tips and advice on caring for your dog. Happy November 4th. I'm Laura Pakis, your host of Coffee Chat. November is Adopt a Senior Pet Month and also National Senior Pet Month, so I thought I'd take some time today to share some tips about elderly pets. Did you know that small dogs are considered senior citizens of the canine community when they reach 11 years of age? Their medium-sized friends become seniors at 10 years of age, and their larger-sized colleagues are seniors at 8 years of age. And finally, the giant breeds, they are seniors at 7 years of age. According to the Journal of the American Animal Hospital, they identify such things as weight, breed, and the state of your dog's organs that all determine when your dog reaches old age. So, what are the signs of aging in a dog? There is a wide range of factors to help you recognize signs of aging in your pet. Many of them are similar to the signs of aging in people. Some of these factors may be more obvious, like an intolerance to exercise or limited mobility, while others may be more subtle. According to the International Veterinary Senior Care Society, there are some things to keep an eye on. Eating patterns is one, and weight of your older dog. You'll want to monitor your dog's eating patterns and body weight, as obesity can cause issues, including osteoarthritis and diabetes. A too thin animal or a dog that won't eat could be having dental or stomach issues. Sleeping patterns and cognitive health is another thing to look for in your pet. Sleeping patterns and cognitive behavior are also things to look out for. A dog that isn't aware of his surroundings or has difficulty recognizing people may be experiencing early canine dementia. Drinking patterns and urination. Check it out with your older dog. It's a less obvious but very important sign to aging is how much your pet is eating or drinking and how much they're urinating. It can indicate many problems, including endocrine issues and kidney disease. Urinary incontinence in female dogs may also be a sign of trouble. It's challenging to watch for, and especially in multi-pet households, but it's something that should be monitored if possible. Monitoring your dog's urination and bowel movements on walks can be a useful tool. Even if both are normal, you may want to notice your senior dog being either slower or more resistant to posturing for a bowel movement. Lumps and bumps, be sure to watch for them and maybe do a daily examination to find them very quickly. Being aware of your pet's overall body condition may also help you spot any abnormalities like cancer. Many dogs develop lumps and bumps while they age. Not every lump will need to be tested or removed, but keeping track of them can help avoid problems. Lumps that are new, growing, or maybe different ones from the other ones on your pet indicate a problem, and always talk to your vet about this. Your dog's behavior may also be indicating signs of aging. Many dogs demonstrate different actions. They become shyer or more apprehensive, and they sometimes vocalize their discomfort. I had the opportunity to interview Dr. James Ha on KSCO Pet Radio. He's a certified applied animal behaviorist, and he specializes in animal behavior and statistics. He spoke with me during the October 31st KSCO radio show in Santa Cruz, California. Here's our interview.
Just as with the humans, we're extending our lives and we're spending a larger portion of our life elderly, I guess, older, and with those kinds of diseases and those kinds of mental health changes and so on, the same thing is happening. The same improvement in healthcare is happening with dogs and with cats, and so again, our dogs are living longer. Thank goodness. That's wonderful. But then, of course, they're experiencing more geriatric diseases and mental health issues and changes and things like that. So I think it's a really important topic. I think there's some basic principles. I mean, I think there's some basic things that people need to know. And the first thing I usually talk to my clients who have older dogs, where I've been asked to come in and deal with a change in a dog's behavior or a problem behavior. A dog has become aggressive or something like that. And when I think it's associated with this aging issue, I have a chat with them about aging. And so here are some of the kind of comments and concepts we need to keep in mind. The first is your dog, as a mammal, as an animal, is going to age and have a lot of the same exact effects that humans are going to. So when you think about your dog, think about, and when we're talking aging, we're usually talking older than 7 years of age, certainly 8 years of age, is geriatric, is senior. And so at that point, when you have a dog that's let's say 8 or older, think about the kinds of changes you see in yourself, perhaps, as you're aging, in your parents and your grandparents. We're all, as I was saying earlier, we're around an older population, aging population, much more than we used to be. People are living longer. And so think about that. Think about the fact that physically, your grandmother, your grandparents, your parents, maybe yourself, aren't quite as quick, don't quite have the physical abilities. The same thing is true for your dog. Think about the decline. We can all sympathize. And so, and so we have the same kind of decline in sensory systems, right? In vision, in hearing, things may not taste as strong. So these are some of the kind of changes that we need to keep in mind. And the same thing is happening with your dog that's happening with yourself or with your family and parents and so on.
Yeah, it's interesting because we did notice our dog, Autumn, she was 13, and all of a sudden she just didn't want to eat the food that she was eating before. And we had to come up with, figure out something that she really would enjoy eating. So do their taste buds change like human taste buds change? I know people want salt more and that type of thing.
Absolutely. That's what I'm saying. It's exactly the same kind of aging issues, the same, a declining immune system, more likely to catch diseases, and have more severe cases of diseases. All the the sensory system, it may, it varies, of course, but may decline so that, sure, taste buds change, the hearing changes. And just as with humans, those changes, maybe more mental fog and confusion, memory loss, and that can be scary, right? And humans have a higher level of cognition, ability to recall memories and get support from each other, and kind of accommodate those changes, right? To get reminded about doing things. We have technology to remind us to take our pills, right, or whatever. Think about your dog and your dog's hearing declining. Are you noticing that? Are you aware of that? They can't tell you, wait, I couldn't hear that, right? They may be going deaf, and that can be a scary thing, right? Or why is your dog misbehaving? Why is your dog not following the verbal signals you're giving? Are they losing their cognition? Or are they just losing their hearing? Right? Do we need to go to visual signals? And so the same changes are going on. And of course, we have the occurrence of diseases. So there's a whole geriatric medicine aspect to this where we're going to see increase. The other factor, the other big change that I see in senior dogs is an increase in anxiety. A lot of breeds of dogs, most breeds of dogs, I tend to see, not always, but I tend to see an increase in anxiety. Now, if your dog has never shown any anxiety whatsoever, it may be just an increase, which may be still very little anxiety, right? But if you've had a dog that's been a bit, anxious, but it's been manageable, it may get to the point where it's not manageable, that it is out of control, that it needs help. And so and what is that? Is that changes in the brain chemistry as you age? Maybe. Is that loss of vision or hearing? Maybe. Is that perhaps a sign of disease, cancer, heart disease, endocrine, thyroid issues? Maybe. There's lots of things that can, as a side effect, cause anxiety. But I very often see anxiety increase. And for quality of life reasons, I really encourage people who see that increase in anxiety to say, why? Why is my dog showing more anxiety? Well, it's getting older. That's an easy answer. Dig into it and see if you can figure out what might be causing that, and if there's a way to perhaps improve the quality of life of your dog by reducing that anxiety. We have some wonderful medications, some wonderful veterinarians dealing with that, certified applied animal behaviors who can diagnose and work with your veterinarian. Get help for that increasing anxiety, because that's a very common aging issue. I think it's for multiple reasons, but it's seen very commonly.
So that might explain. My one dog, he was used to one car, and he was a giant Schnauzer, and he was about 7 years old when I got a new car, and it just was so frightening for him to be in this new car. And he was just the perfect dog, and it just threw me for a loop, because I couldn't understand, if he could adapt to all these other things, why couldn't he adapt to the car? So this, you're kind of explaining
because of his age. Yeah, it something that would be not even an issue when he was 2 or 3 years old. You don't have the bandwidth. You may not have the emotional ability, to just bounce back from that, right? And it's a whole new space, a whole new car, all new smells, all new sounds. This is like overwhelming me, right? At 7 or 8, and this happens to humans as well, right? And a huge issue, with moving grandma from the home to, say, an assisted living facility, right? Very confusing and stressful, and so on in many cases. Wait, you used to move houses in the military every 3 or 4 years when you were raising the kids. Yeah, you don't have that kind of resilience, and cognitive ability to cope with that you used to have. Same thing with your dogs. Wow.
Yeah, I never would have thought of that.
Yeah, I mean, and it is a matter of the close relationship, for tens of thousands of years between humans and dogs, that there are a lot of people who are very sensitive to their dog's emotions, changes in their emotional state. I mean, there are a lot of really good, dog owners and dogs that trust. They've built that trust, and dogs that trust. And a dog that trusts its owner, its guardian, is going to reveal some of those things, a limp or, something like that to them. And they're going to be sensitive and pick up on it. And that's a strong relationship. Books have been written about, these levels of relationships. Something had changed, and we needed to dig. And I know something had changed with my dog, and we need to find out what it is. Maybe there's nothing you can do about it. Maybe there is something you can do about it. Let's try, and you would do the same thing for your grandmother, your grandparents, your parents. That's a strong and a strong bond and a trusting relationship. We have a lot of tools. Research is moving very rapidly. There's a lot of good science now happening and at a much faster rate. There are some really good professionals like the veterinary behaviorists, like the certified applied animal behaviorists that are out there, like the people that they're training. That's something I'm very active in, who are becoming aware of these issues and can help with them and know what the solutions are. And so it's something that you can get help with. But so the real rule, the bottom line for me is, your dog is going to change as it ages. Expect it to change. Be ready to you're going to change as you age too, and so be ready to accommodate that. Be ready to be sensitive to that. Don't, as simple as the dog that used to jog 3 miles with you every day, that may be becoming too far. Arthritis, whatever, that I see so many dogs in pain. They go, well, he's always jogged with me. And I have to say, well, I don't think he should be, maybe you're still young enough to jog 3 miles. Your dog may not be. And so there's a physical decline can occur, as well as these mental and behavior changes.
What kind of things, Dr. Hull, what kind of things can we do to help our geriatric dogs so that we enrich their lives as they get older?
Well, do watch the physical exercise. That's a careful balance. Certainly talk to your veterinarian about exercise, annual checkups. Is my dog still in good enough shape to jog with me or, whatever, hunt with me or whatever? Be sensitive to the physical stuff. The mental stuff, good veterinary care. A lot of what is going on when there's behavioral changes is some kind of a physical condition. Thyroid, diabetes, all the sort of Addison's diseases and changes like that. Those all can be medicated. Those all can be corrected, right? But how do you know that your dog even needs to be checked thoroughly? It's an extra check. It's something digging in deeper. It's almost always the behavioral change. My dog has never been anxious in this situation before. My dog has never fill in the blank, right? Watch for those changes and go to a veterinarian and say, why is my dog changed? And if they give them an absolute clean bill of health and you're sure it's been a thorough exam and tests and evaluation, then there may simply be behavioral changes, cognitive decline, and go to a good behaviorist. There are ways, if it's anxiety, there are medications that just take care of the anxiety. If the anxiety is being caused by an underlying medical issue, I'd rather take care of the underlying medical issue. If the anxiety is by itself is just aging and cognitive decline, there are medications that take care of that. So it's being aware and sensitive and intervening on behalf and advocating. That's the word I'm looking for. Advocating on behalf of your dog. Pushing to get the test done. Pushing to say, no, my dog's behavior has changed. And there's a reason why the behavior has changed. Let's try and figure out what it is. And it may mean going to a high level, a really qualified behaviorist, really qualified veterinarian.
That makes perfect sense, though. So, yeah, I mean, you're making me, I'm hearing all these things and you're making me think about all the things that the dogs have, as they get older that they're going through. What surprises me is how resilient they are, because I had a little guy and I did not know he went blind. And I kept thinking, he's missing the couch or he's doing this, but he was so comfortable in the house. It just surprised me that I learned that he was actually blind.
Well, remember that they're going to try and hide it. They're going to try and hide those behaviors. They're going to try and hide the illness. They're going to try and hide the limp. They don't want to look different. When you're a social animal and a social species, you don't want to stick out like a sore thumb. You don't want to be different, and they try to hide it. And that's why this takes, don't kick yourself, if you miss it. But on the other hand, if the dog is missing the couch all of a sudden, don't just ignore it. Think about, why might that be? Oh, he might be going blind. Let's get a checkup, right?
Yeah. Yeah, I mean, you would never think of it, though, because it happens so gradual. I guess that's the thing. And wow, that's interesting. So they're very stoic. They don't want anyone to know what's going on.
That's right. And they hide it so well. And I probably told the story before. I go into somebody's home and I watch their dog for a few minutes while I'm talking to them. Dog doesn't know that I'm watching them, and I say, your dog has a limp. There's pain. They say, no, my dog's not limping. And you look over, we all look at the dog walking by, there's no limp. But if we videotape the dog in the room by himself, there's a limp.
Wow. They're that adept. That's amazing. Well, I guess that's how they survive in the wild. I mean, that's kind of instinct.
That's how you survive in a social group. You don't want to stick out. You don't want to be too different, right? Because you may be judged to be, of lower level or not worth sharing as much food with, or, and so you don't want to look injured or ill to a predator, right? And so so eyes are on you. You hide it. And so to see that, to be aware of that takes a little extra focus.
This has been wonderful information because, I think half of it is some of the stuff. I mean, when you're saying it, oh yeah, that makes perfect sense. But unless you're aware of this, you really don't think about it with your dog. I think you have that vision in your mind that your dog will never get old. But you're saying at 8 they're getting old, which to me is like there's still a lot of life in them at 8. So how did they come up with that idea that 8 is like the senior?
Well, we've done a lot of research on that, and so we can measure a whole variety of different things, like aging, decline of the immune system, decline in the production of red blood cells and white blood cells, decline in the rate of growth of neurons in the brain, and these are all milestones where the decline starts, or a certain level, half of the white blood cells that you had, at one time, baseline, and so on. And so we know what that reflects and at what age that occurs, and it's different in different breed groups and so on, but we know where that occurs, and we also know how that matches up with the same changes at what ages that occurs at with humans, and the old rule of thumb was 7 years. An 8-year-old dog is about 56 in human years, and that's crudely correct. A recent paper came out, and I know it was in the newspapers and stuff. It's a couple of years ago where they really corrected that. It's not quite so straight and linear and easy, just multiply by 7. It's a little more complicated than that. So they made some adjustments to that, but the 7-year thing is a good rule of thumb. It's a little different. It doesn't work down in the very young ages, but it works well at the older ages, and gives you a rough idea about where you're at. So, a dog that's 8-year-old is 50, 55, 60. A 10-year-old is 70. That's what you're talking about. And it does vary from breed group to breed group.
Well, Dr. Hudd, as they get older, they tend to sleep a lot. Should we let them sleep, or should we do something to kind of keep them stimulated and moving around?
No, in fact, as the elderly do in all populations, they need more sleep, right? And so if you think your dog is sleeping more and more reluctant to go out for, exercise, getting tired sooner, that's an aging dog. Now, I would strongly encourage, you notice that? I would strongly encourage to make sure you're getting a very thorough checkup. And the vet says, no, your dog is old. Nothing else wrong. That's what happens as we age, right? And naps become much more important.
We're out of time. How do people find you?
drjimha.com.
drjimha.com. And thank you so very much for being with us.
If you're interested in learning more about the topic of senior dogs, Acme Canine's website has several articles on our blog, and they can all assist you. That's www.acmecanine.com. Also, if you're interested in supporting an organization that improves the lives of at-risk senior dogs by providing funding and resources to animal shelters, rescue organizations, sanctuaries, and other nonprofit groups, consider donating to the Gray Muzzle organization. Here's some information on it. They're not a shelter or rescue group. Rather, the Gray Muzzle organization funds programs such as hospice care, senior dog adoption, medical screening, and other special programs to help old dogs at animal welfare organizations across the country. Well, we're about out of time. I hope you learned a little bit about senior dogs, and maybe we'll do a little bit of research on our website. And you know where to go to gain that information. So for now, I wish both you and your dogs a very happy Thursday. All the best.